In Korea, the Act on Decisions on Life-Sustaining Treatment for Patients in Hospice and Palliative Care or at the End of Life was enacted in February 2018. From now on, I will call this act as the LSD Decision Act. After the enforcement of the LSD Decision Act, the total number of notifications and brain death organ tissue donations began to decrease. According to Korean Organ Tissue Donation Annual Report, the number of brain dead organ donors rose steadily until 2016, when the number reached 573, 11.28 per million population, after which it declined to 515, 10.01 in 2017, and dropped sharply to 449, 8.70 in 2018. Many studies have addressed emergency physicians' attitude and perspective on brain death, organ tissue donation, and the decision to withhold and withdraw LSD. However, to the best of our knowledge, no study have explored the experience and perspective of brain death organ tissue donation among emergency physicians in Korea. Therefore, we sought to explore emergency physicians' experience and perspective related to brain death organ tissue donation after the LSD Decision Act was implemented. This is a qualitative study using the semantic analysis method. This study analyzed interview data from emergency physicians regarding their experience and perspective on brain death organ tissue donation since the LSD Decision Act. The inclusion criteria for the interview were board registered emergency physicians in the Korean Society of Emergency Medicine who treat post-cardiac arrest patients with targeted therapeutic management, called TTM. To select and recruit physicians, we performed purposive sampling, and then we conducted the interview between December 2020 and January 2021, till new perspective or experience no longer appear in the data, and this point is called data saturation. When we interviewed the eighth interviewee, data saturation began. After the 10th interview was conducted, we concluded that sufficient saturation had been reached and the recruitment of participants was stopped. There were 10 emergency physicians. Most of them were in their 40s and were men. The study data revealed 13 sub-themes and 5 themes. Let's talk about 5 themes now. Theme 1 was the LSD Decision Act is easier to explain to family members than brain death organ tissue donation, but it does not fit well in an emergency medical settings. Physician D said this: in the end, from a practitioner's perspective, and this is what we felt before, we could not make decision to stop LSD due to the law, but now stopping LSD can be done easily. And D also said, LSD is well recognized, it is going on, and the medical staff seem to be actively explaining it as well. Organ donation is actually not well explained if a patient aren't candidate for it, although even if they are candidate, they tend to be reluctant about organ donation as well. Even medical staff know how to explain life-sustaining care easily. Theme 2 was many family members decide to stop LSD before physicians even mention brain death or organ tissue donation. Physician I said, in the media, the suspension of LSD has been promoted. Many people know about that. In many cases, they bring it up first, asking, can't LSD be stopped in this case? Many people say that. Thus, it is difficult for us to explain organ donation. Theme 3 was family members view stopping LST as being about comforting patients without bothering them, and disease makers are therefore no longer willing to choose organ tissue donation. Physician H commented, "Yes, that's right. I think so. They don't want it. They simply want to let the patient go more comfortably. The family members have no interest from the moment they provide written consent to stop LST, so the medical staffs feel the same way." Theme 4 was stopping LST does not always result in brain death, but cases of brain death are preceded by stopping LST. About this theme, physician A said, "When the family asked if this person is brain dead, then when will it be brain death? No one can guarantee that brain death will be declared, or if so, when?" Then the families ask themselves, "Do we have to pay all hospital bills until brain death? If this happens, they will not be able to donate organs." It seems that families are deciding more often that they just want to stop at this stage rather than continue to struggle. Thus, there appears to be a trend in which people who might become brain dead die before they actually do. Theme 5 was, since the LSD Decision Act, the number of TTM cases and potential brain death donors have decreased. Physician F commented, "Since the medical staff focus on making decisions about life-sustaining care, they do not seem to provide an option for organ donation. These appear to have affected the reduction in cases." The findings of this study suggest that the increasing trend in choices to withhold and withdraw LST in patients resuscitated after cardiac arrest is expected to continue for the time being, and the brain death organ tissue donation is likely to decrease unless a supplementary policy that connects stopping LST to brain death organ tissue donation is prepared. So we suggest that the CODA coordinator be automatically connected with the patient family members who choose to withhold and withdraw LST, including in the emergency department. And more, community should form organ transplantation teams that will work with multiple regional emergency medical centers to improve coordination and collaboration.